And welcome to the Deuk Spine Institute operating room here at the Surgery Center Viera in Florida. It is Tuesday, January 16, 2024. Our patient comes from Dallas, Texas. He flew here with his wife. He has a herniated disc with an annular tear, C5-C6. He's having horrible neck pain, and he does not have facet pain. So the two most common causes of pain in the neck are disc herniation with annular tear, called discogenic pain, and facet joint pain. He did not have facet joint pain, and on MRI, right where he was pointing his pain was C5-C6. There is a herniation there with an annular tear. As you can see, thank you, Luis, from his MRI, the herniation is not big, it's small. But small things do cause big problems. So we believe his one herniation at 5-6 is the cause of all of his neck pain and headaches and pain radiating into his shoulders. That said, his pain is worse on the right side, so we're going to go opposite on the left side. That's where our entry point will be. And we go across the disc to the other side. Take a look at his neck. Compare it to the surgery we just did. The last patient had a short, thick neck. This patient has a long, skinny neck. It makes all the difference in the world. We could actually get all the way down to the thoracic spine with him. Here we go. Just verifying everyone agrees, C5-6. So the first step in the surgery is to palpate the spine. Thank you, Dr. B. You want to feel the front of the spine with your fingers. Only possible when you actually have the patient relax. 2, 3, 4, 5, 6, we're a little low. So I can go up a little bit higher. He's got a big Adam's apple. What I'm doing is creating a space, but I can literally feel the spine right here. Shot. 2, 3, 4, 5, 6. I'm just below 5-6. I'll move up just a little more. And there we go. Now, if our patient was awake, he would never tolerate what I'm doing. He would literally be fighting me. Shot. Perfect. 2, 3, 4, 5, 6. AP. So we have to intubate the patient so we can relax the muscles. All right, I'm way off to the other side, so he's doing awesome. Shot. We're back to the center. Perfect. And again, shot. All right, that's the middle of the spine. Lateral view. Shot. Wonderful. 2, 3, 4, 5, 6. Luis, you agree we're at 5-6? Here we go. Shot. Wow. That went in nice and easy. Give me an AP real quick. Let's just check 100%. The way this surgery is possible, and by the way, we're the only center in the United States that does this surgery. Okay, lateral. It's perfect. And it could be done by all the doctors out there, all the surgeons. But they choose not to do this surgery because, well, it doesn't pay as well as invasive surgery. Invasive surgery pays more money. So these surgeons are not recommending endoscopic surgery because they want to make more money and because they don't know how to do the surgery. There's your tear right there. Beautiful. Get that. Hey, let's put this on the website. This is another website picture. Keep your arrow right there. Henry, take a picture right here. This is beautiful. Huge tear. And now, Jordan, put your arrow on the disc herniation. So you can see the tear and you can see the herniation right there. See the little bubble? Henry, did you get that?
Yes, we did.
All right, I want one with the arrow on the tear. Go back to that, Jordan. Again, Henry, just capture that right there. And then drop your arrow a little bit, Jordan. There we go. Perfect. That right there. Get that right there, Henry. Let me know when you got it. And then get the herniation. Just go below it. Right there. Perfect. That's the herniation. Again, let's count. 2, 3, 4, 5, 6. So you can see the dye was injected in the middle. It leaked out through the tear in the back. That's why this patient has so much pain. Annular tear with a herniation posteriorly. Deuk Spine is the only center in the world that does this surgery. It's called the Deuk laser disc repair. Now, the first surgeons to do endoscopic cervical were the Koreans, South Koreans. As I said last surgery, Dr. Sang-Ho Lee and Dr. Gun Choi, they taught me about 18 years ago. I brought this technology to the United States. And in 18 years, I've been trying to teach other surgeons, going to the meetings, publishing papers, publishing more papers, giving talks at meetings. But the problem is these surgeons don't want to do less invasive surgery because they're making so much money doing fusions. Not just money for the surgery, but they get kickbacks from the companies that make the metal plates and cages. All right, shot. At this point, we've made our incision. It's literally 4 millimeters. Thank you, Luis. You guys see that?
Yes, we do.
This is pretty much bloodless surgery. I say that as we have our first drop of blood, but that's it. You're going to get literally one or two drops of blood. Shot? All right. I'm going to take my needle out, leave the guide wire. Shot? You want to stabilize the guide wire with your one hand while you slide the needle out with the other. Do not make the mistake of trying to do it with one hand. You need two hands, one stabilizing the guide wire, shot, and one pulling the needle out or putting the dilator in. All right, Henry, let's show our audience why do these annular tears in the back of the disc cause so much pain. We've been preaching about this for 14 years now. No, sorry, 12 years. I apologize. 12 years. We've known about it longer, but we've been trying to teach everyone else about the annular tear and how painful it is, how it causes neck pain and back pain and thoracic pain, but people don't want to listen. Down a little. Okay, welcome back. You can see now how tears cause pain through inflammation. Look at the arrow on the screen here, Henry. That's a tear. It's off to the right side. Remember, his pain was off to the right. You don't see the same thing on the left. It's just the right. So he has a right-sided posterior tear at C5-C6. Show us the lateral margin of the tear. Yep, right there. Henry captured that as well, screenshot. And then show us the nerve root with dye wrapping around it. There it is. So you can see how the nerve root, and it's a dark thing. See the nerve root right there? That's the nerve root. Look how close it is to where the tear is. You see that? The tear leaks inflammatory juice onto the nerve root, causing arm symptoms and shoulder pain. Great job. All right, now we're going to get into the disc. Lateral view. So here we go. Taking out the guide wire, leaving the dilator. We're going to push the dilator like you push a pin through your clothing. We're going to gently go in and get to the back where the tear is. You see where the tip of the dilator is now? So take a picture of that. And Henry, give me a screenshot. I'm just going to use this whole sequence for our new website. So arrow at the tear. Show me the tear. There it is. See how the dilator tip is right at the tear? Show the herniation. Yes. Okay. Henry, do you get a few more screenshots there?
Yes, I did.
Shot? All right. Now we're advancing. Now you can see how the dilator tip is inside the tear. Go ahead and get a picture of that with the arrow there. Henry, another screenshot.
Copy that.
Not there. Show where just put it at the tip. Right there. A little bit lower so you can see the disc part. A little lower. Right there. Shot of that right there, Henry. And send that to me. All right, good. All right, any questions from our audience?
No current questions.
In case you haven't picked up on it, we are building a new website and we're trying to make it extremely informative for people so they understand what we're doing and why we're doing it. Shot? As I deliver the tube down into the disc, I got to keep an eye on the dilator. You see how it's getting pushed back a little bit? That's happening because of the pressure inside the disc. There's a lot of pressure in this disc. Why? Because the disc is under inflammation, lots of inflammation right back here. And all that inflammation, Shot? See how it pushed it back by itself? Do you see that, Henry? Shot? I literally advanced the dilator into the herniation, and then I put my tube down to try to slide the tube down. Shot? And look how the pressure is just pushing the dilator back. This guy's disc is under massive pressure from the herniation and inflammation. That's why he has so much pain. You want to know what causes neck pain, folks? This is it. Inflammation, Shot, from a herniated disc. Specifically the tear in the back of the disc. Take a picture of that. Jordan, put the arrow there. Right where the tip of the tube is. Yes, right there. Perfect. Henry, can you get that?
Already did.
All right, so you should be getting several pictures here, Henry, in sequence.
Yep.
Right, so we got the needle with the discogram, AP lateral, showing the tear where the herniation is. Then we got the dilator tip at the back where the tear is. Then we got the tube at the back where the tear is. So the whole purpose of all that was to bring this tube down to the tear where the herniation is. I need that. Can you help her, Jordan? Now we're going to go in. You guys see the inflammatory tissue, the red stuff? That's all inflammation. That's why we're here. Look at this piece right here. Check out the pink color. Look at the pink color. You guys see it at the bottom? Like right there?
Yes, we do.
That's inflammatory tissue. That's what's causing all of his pain. The tear is inflamed. Folks, don't let these doctors do fusions on you and artificial discs anymore. You don't need it done. All you need is this laser, Deuk laser disc repair to get out of pain. Done at the Deuk Spine Institute. If you can't find it done where you live, come to the Deuk Spine. This patient traveled from Texas, the last patient from Massachusetts. The next patient is from New Hampshire. Thank you. A little voice inside my head said New Hampshire. So today our patients are from Massachusetts, Texas, New Hampshire. They travel to the Deuk Spine Institute from all over the world because we offer the most advanced spine surgery in the world right here. And they don't want to have metal in their spines. Do you blame them? I wouldn't. I wish to God I found a Dr. Deuk Majan if I had a spine problem. Look at all this swollen disc tissue, full of edema from inflammation. So far, so good. Look at all these chunks of herniation. That is another chunk. Do we have any states of the United States that we haven't had a patient from? We've had it pretty much from every single state, right? We've had Arizona, New Mexico, California, many, Las Vegas, Nevada, Mississippi, Louisiana, Arkansas. Yeah, look at the tear right there, by the way. That is the annular tear. The white is annulus, the and disc material. The blue is the herniation. That's degenerative. Yep. We've had Ohio. Many Ohios. Jersey, New York. I think we've had every 50 state come here, at least one. And of course, countries outside the United States. Ecuador, there's a big herniation. I said outside the United States. Tennessee outside the United States. Poor Tennessee, I bet they felt like they're outside the United States, right? Do you see that snow and ice in Tennessee? Holy moly. Huh?
They were at 20 degrees for a couple days.
Yeah, 20 degrees. Well, actually, tonight we're going down to 40, right? A whopping 40, 41, which means I have to bring my orchids in. Luis is laughing at me.
I thought you can put a wrap or something on the cover then.
Yeah, but
Not today, it's gonna
I have them on my patio, so I got to bring them in. I just repotted an orchid today. A couple of them. Vandas. Actually putting this Vanda variety in a pot. Not really, it's just sphagnum moss that keeps it moist. Anyway, any questions from the audience about the spine?
Yes, this question comes from Big John on YouTube.
Big John!
They ask, good morning. A week ago, you had another cervical DLDR with a lot of inflammation and calcification, and occasionally when using the laser, there was blood that came up and out from the laser working. Does this bleeding cause pain post-surgery, and do the spots that bleed stop bleeding as the effect of the laser causes a catheterization of the areas that bleed?
Big John, that is a loaded question. Great question, though. So, yes, last week we had, and anytime we have a patient with a lot of bone spurs, we've got to do some bone spur removal if the bone spurs need to be removed. Not all of them need to be removed, though. I always say that. And, of course, those bone spurs do bleed, but they don't bleed excessively. The amount of bleeding is very minimal, and it's not a concern. However, as you pointed out, that causes inflammation and pain. So it brings on a new type of pain usually, but in the same area as where patients had the problem before. So yes, removing bone spurs, it does get bloody. Not bloody like a lot of blood, but we're talking a few cc's because these bone spurs are very small, very, very small. And that can definitely cause pain. The problem with blood is that as it breaks down inside your body, it irritates the tissues and causes inflammation, which is why we try not to get too much blood. We try to irrigate it out. But every surgery is going to have some blood that's left in the patient. It's impossible to do surgery without bleeding. The surgery we do here is the closest a human being can get. It's a bloodless surgery. Which laser are we using? 60?
60, yeah.
All right, great question. And yes, the bleeding stops, your body coagulates, but the blood that's there under the skin around the tissues, it hurts. It causes inflammation. And it's a great question. The reason why the blood causes inflammation is when your red blood cells break down, they have what's called hemosiderin that's deposited in the tissues. And that hemosiderin is very pro-inflammatory. It makes your inflammatory system very angry, and it creates pain and tenderness and swelling. But it always goes away on its own. You don't have to do anything. As the bruising or blood disappears over time, it gets, dissolved by your body, then the pain goes away. All right, these are all pieces of herniation. Now, if you look at his MRI, it doesn't look that bad, right? You can barely see anything. Most doctors would just tell him you got a small herniation. It's not doing anything. You don't need treatment for it. But you do, because it's not going to stop hurting until you get it fixed. By the way, this patient's disc right here, what you're seeing, is what we call relatively well preserved, meaning he doesn't have a degenerated disc too bad right now. It's very mild. And a lot of people wait on getting fixed. They wait too long. They wait until for years, unfortunately. And if you wait that long, you're going to have more damage done to your disc. Your disc is going to collapse. It's kind of like having a tire that's bad. If you keep driving on that tire, you're not going to make it better. It's only going to get worse, and it gets worse a lot faster. So I tell people, if you have a disc problem like this, even if it's a small bulging disc, get it fixed with the laser surgery. That way you stop hurting and you don't get too much bone spurs, you don't get too much degenerative disc disease, you don't get too much radiculopathy, because the longer you wait, the more permanent things become. Great question, Big John. Thanks for joining us. All right, this is a lot bigger herniation than I could tell on the MRI. Look at this. So many pieces. Again, could not tell that based on the MRI. Take a look at the bottom of your screen. There should be an MRI down there. And you just, doesn't look that bad. Like most of the time, doctors would just blow that MRI off. It's not bad. You probably have something else causing your pain, but look at all these chunks of herniation. Another one. So I don't treat the MRI. I always tell people, don't look at your MRI and expect it to look normal when you're done. We're not here to treat an MRI. MRIs are very misleading. Yes, we need the MRI to figure out what's wrong with you, to help figure out, but we don't, use the MRI as a gauge of our treatment, especially if you're treating pain. Pain is something the patient experiences. The MRI will never tell you why a patient has pain unless they have a fracture, tumor, or infection. If the patient has a fracture, tumor, or infection, then you'll see it on the MRI. And, as long as the pain correlates with that area, then you know what's causing it. It's a fracture, tumor, or infection. All right, I'm working my way towards the middle of the disc here and setting off to the patient's left side. You can see there's still some blue stuff. That is degenerated nucleus pulposus, okay? So even though he was more symptomatic on the right, he also has some herniation on the left. So I'm not going to just leave it there. I'm going to try to get it all out because, let's face it, he's here for a reason. He wants to get out of pain, and if I leave that stuff, he may still have pain. So I want to get as much of this disc cleaned out. Look at all these pieces. He must have really smacked his neck pretty good. All right, almost done. 5 minutes, doctor. So he's a 1 disc, just like the last patient. The last one was a 6-7. He was a repeat. This is a 5-6, and both of these patients were single. The last patient, if you missed the surgery, was a patient who had the Deuk laser disc repair, and then he reherniated. And we do get our patients reherniating from time to time. And the reason he reherniated, he caught a 100-pound grouper. And rather than just figuring like, hey buddy, get this fish out of the water for me, to his friend, he decided to take it out of the water himself. So he reeled in a 100-pound grouper. Now the thing about a 100-pound grouper is that they don't come easy. They fight you. And when they fight you, they're not fighting you with 100 pounds. They're fighting you with about 300 pounds, all right, of thrust. So my patient was feeling so amazing, he went deep sea fishing, caught a 100-pound grouper, and reeled it in. And of course, reherniated. And that's why we had to do a surgery again. So it's good that we have a patient or two like that to remind people. If you don't follow the rules, and don't do what we ask you to do, sometimes you get problems. Okay? Honestly, if you're going to break the lifting rules with this surgery, then there's a good chance you're going to end up with a reherniation. So he did, he gambled, and he got it. Yeah, I've just got to clean a little more out. All right, Henry, what other questions you got?
No current questions. We just have a comment from Big John who says you are welcome. I think that was from in context of what you said earlier.
Sure. All right. That's it. I'm going to come back and look at that left side one more time, and I'm off on his right side right now. And we're just cleaning everything out here, and I got about 2 more minutes and we should be done. But there's the herniation there, another one sitting in the foramen, right, Luis? And well, you can see from watching this lots of pieces of herniation just flittering up. Every one of those is another herniation, folks. I'm not making those herniations. They're already made. They're already there. Okay, and this is the big tear we saw earlier. Big tear on the discogram. This a lot of scar tissue. He's starting to get some calcium in there. You see that? But a lot of inflammation. You see all that golden and white strands? Inflammation. Inflammation. That's where all of his pain was coming from. Now, he's going to be sore tonight because we just did the surgery, but by tomorrow I think he's going to be feeling like a new man. Gosh, a lot of herniation. See all this stuff? It's like snowflakes. All right? I say 1 more minute, we'll be done. Unless something weird happened. Suddenly find a ton of herniation. All right, that looks pretty good. By the way, check that out. See that white stuff? That's normal disc right there. That's the left side, and that's the side we didn't really have a problem with. Okay? But the right side, you could see there was a giant chasm, a giant crack in the back of his disc, and that's what we're here to repair. Let me take one more stab at this. I'm going to advance my laser. By the way, for those of you who've never seen this, that laser fiber is 0.5 millimeter. So it gives you a perspective on how delicate and, what do you call it, precise the work we're doing is. Okay, we're done. That should be it right there. Looking good. Just want to get the last of these pieces out. And that should be it. Good work, everyone. That was nice and sweet. All right. Henry, turn the light. Check this out, Henry. Look at all that. See this?
Yes, we do.
Okay, see all these little pieces? These are all pieces of herniation. There's 50 pieces there. Some small, some large. But that's what you're dealing with a herniation. We're going to irrigate, see if we can get any more out. But, you know, herniation is not one piece. It's usually a lot of pieces. And the disc gets smashed. So whatever caused this, it's trauma. It's trauma, some kind of trauma. And the patient smashes the disc, the nucleus, into pieces, which you see there, and they also tear the wall. And when you tear the wall, then the pieces can escape, and that's where you get a herniation. We're the first in the world to describe that. No one else has ever known that or talked about it. All these other surgeons think a herniation is one piece, and they talk about getting the herniation out. But the herniation is really, I would say on average, at least 25 pieces. And nobody's ever described the mechanism by which discs are herniated. It's trauma, and it's a tear in the annulus with a crush of the nucleus next to the tear, and then the fragments of nucleus escape through the tear with everyday activities, like lifting up a baby, picking up your dog, going to work. So that's why it's so confusing, is that the initial injury, the initial trauma is what causes all the damage, and then the aftermath of that is what people experience years later. Okay? And that's when it's diagnosed and they say, oh, you have a herniation. And we're going to show all this on our new website. Whenever you're ready, Luis. Oh, by the way, take a look at the incision. Look at that. That's the hair of his beard right there. You see the hairs of his beard, the Adam's apple? That's how small the incision is. 4 millimeters. Good picture there, Hen?
Yes, perfect.
Send me that one too. So,
Copy that.
no bleeding. We had 1 drop of blood, folks. 1 drop. No metal, no fusion, no cage, no cadaver bone, no fusion, no backed out screws, no adjacent segment disease, no trouble swallowing, no hoarseness for the rest of his life from surgery, no scar tissue. It is the most perfect surgery you can do, done here at Deuk Spine. Don't settle for bad spine surgery. Scopius was a 4. All right, Henry, tell them to type up their questions, and I'll be there to answer them shortly. I'm Dr. Ari Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4-millimeter cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I couldn't. I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something. I'm Dr. Deuk. I'm here with one of my patients on February 1st, 2023. And you just had surgery on your neck, the Deuk laser disc repair done with a 4mm incision to fix 2 herniated discs, her C6-7 and her C7-T1. And you had a long neck. We were able to get down to the C7-T1, and she had a very large herniation there. So your surgery was about 24 hours ago. How do you feel today?
I feel like a different person. I feel I was able to do many things this morning that I haven't been able to do for 4 months, and that is just get out of bed and just take my first steps and have 0 pain. And I haven't had that in 4 months. First step out of my bed was always the beginning of my day, and it was awful. And today I took my first step out of the bed and it was glorious.
Good for you. And before surgery yesterday, you had been suffering for about 6 months with neck pain going into your right arm, correct?
About 4 or 5 months.
How did that affect your quality of life?
Every day is difficult. I mean, I have a 10-year-old and a 5-year-old boy, and just the basic duties of a mother every single day was just unbearable and difficult. So quality of life was not very good. And so it is now.
And so the pain, obviously, because of the pain, activities would set it off, so you were limiting what you were doing. You were limiting what you were able to do as a mother.
Yes, there was things I were not able to do, and be the best mum that I can be was not one of them.
Well, you look very happy right now.
I am.
Why are you so happy?
Because I'm pain-free.
Yeah, and you didn't have to have a fusion or an artificial disc put in your neck, did you?
I did not.
Did anyone offer those surgeries to you?
I did. I was offered those surgeries. I was told that I needed a fusion, the possibility of disc replacement in 1 or 2 years down the road, but it was my decision to go in and have those taken care of if I wanted to. But there was also a possibility that once the doctor got in, that he could not replace those 2 discs, so he'd have to fuse those 2. So that to me was a possible 3 fusion, 3 discs being fused.
Mm-hmm.
And I know the consequences of that, so that's why I came for your opinion, in your professional opinion, what can be done in a less evasive way. Or that was an option for me, and here I am.
And I'm really happy it worked out for you. You can see in the video, we were able to get down to C7-T1, which is really a first endoscopically. And, you know, because you had that nice long neck, we were able to do it. And there was huge pieces of herniation down there. Your other disc was more degenerated, and we were still able to get that fixed as well. So I'm very happy you're doing well. What's life going to be like now that your neck is fixed?
My quality of life is just going to be a lot better than what it was. I'm going to take it easy, and I know that I need to take it easy, and I'm going to be careful, but I'm going to wake up with a smile on my face now instead of tears.
Well, congratulations.
Thank you so much.
Is there anything else you want to tell your fans out there?
Come see Dr. Deuk. He'll fix your pain and make you walk out with a smile on your face.
Excellent. All right. Good to see you. Good
Thank
to see
you. Thank you so
You're
much.
welcome. Good morning, I'm Dr. Deuk. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk. And I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4 millimeters, because you had 2 discs that needed to be fixed or were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct, I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
Within an hour. Yeah, that was nice to be able to recover at home.
Yeah.
Not have to go to the hospital.
Correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. And good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today, so big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery is over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None?
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4 millimeter incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4-C5, I believe, and maybe C6. The recovery time was 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right. Wow, what a great testimonial and what an amazing case. So this young man that just had surgery we've just completed, he injured his spine and his neck through trauma. He's had pain for a long time, and we looked at his MRI. We just saw a small C5-C6 tear and bulge. And it turns out the number 5-6 disc is the most common to be injured, most common to cause problems. So by far. So we were looking at it and I realized that's got to be the cause of his pain. He had no facet pain. The way I knew that, he had no pain with rotation. Facet pain is always rotation or extension. So we identified 5-6 as the source of the pain, and we just completed that surgery. Now, when you look at the MRI, it really doesn't look that bad. But when you got in there, you could see he had 30 or 50 herniated pieces of disc. All small ones, big ones, everything in between. We got it all cleaned out, and what was really cool, if you go back and look, near the end, I kind of looked to the right side, and you could see that beautiful white stuff. That's normal nucleus and normal annulus. So you could see his tear was actually, well, when I say right side, it was the right side of the scope, which is really the left side of his disc. It was really the right side of his disc from about the middle over where there was a giant tear. And if you go back and look at the discogram at the beginning, you can see the dye leaking out through the tear on the right side. Big tear on the AP view, front back view on the right side. And so basically this is a really interesting case because it shows, you know, a lot of times we see discs with the tear across the whole back, left to right. This guy had it pretty much from the middle to the right, and the left side was fine. So I cleaned all the herniation out above the left area, and then to the right, cleaned out the crack, cleaned out the foramen, and everything went perfect. But the left side looked good. It looked fine. So we left it alone. Anyway, questions?
This first one comes from, sorry if I can't pronounce the name right,
ECAF.
ECAF, they said from YouTube, you can reduce a herniated disc or bulging disc with a bit of bone spurs or just stop his progression with the laser?
Yeah, so ECAF, the laser surgery you just watched will literally stop the disease from progressing. So once we clean the tear with the laser like we just did, the tear will mend and seal. It cannot do that until we take the herniation out. And the Deuk laser disc repair is the only surgery in the world, right here at Deuk Spine, it's the only surgery in the world that cleans out the tear and lets the tear heal. Once it heals, the disc will not degenerate anymore.
And then this comes from, excuse me, Jason after Jason.
Jason after Jason, good to have you back.
They said, they asked, does the disc repair provide full decompression of the root of the nerve root when there is also ligament thickening and arthritic bone present as well? I mailed my MRI last week, and also with the testimonials, the smiles on your patients' faces say more than any words can express.
Thank you. Yeah, the surgery we're doing definitely takes care of everything needed to be taken care of. Now, that said, if you go to other spine surgeons, they're going to try to convince you to have their cages put in and metal plates. So they actually start making things up that, oh, you got bone spurs, you got ligament thickening, you've got to have a fusion, the laser won't work. Don't believe a word they say. We've had patients with very thick ligaments, very big bone spurs. We're still able to get rid of their symptoms completely with the laser surgery. The reason for that is that all the symptoms come from the annular tear inflammation, which we clean it out, and usually from nerve root being compressed or irritated, which we fix that as well. Bone spurs do not cause any symptoms. I have never seen a bone spur cause symptoms. It's extremely unusual for a bone spur to cause symptoms. So lots of people have bone spurs. We all get them as we get older if we have injured discs, but we don't have symptoms. So bone spurs by themselves, herniated disc by themselves, do not cause symptoms. Spinal stenosis doesn't always cause symptoms. So you guys have been programmed to look for these things because that's what doctors talk about. But doctors are completely wrong. It is not spinal stenosis we care about. We care about spinal stenosis that's compressing the nerve root enough to cause nerve root symptoms. But for every person that has spinal stenosis compressing the nerve root enough to cause nerve root symptoms, that patient, there's a 99 more just like them that have no nerve root symptoms. We don't fix those 99. We leave them alone. So it's only the people that are symptomatic from the pathology that's being seen that need treatment. And bone spurs just don't cause symptoms. That's just a fact. Okay?
And this next question comes from MD Albalasi.
MD Avalasi, very nice for you to join us. Thanks.
They ask, is the endoscopic surgery applicable for pure posterior lumbar herniation? As I was told, it is very effective for posterior lateral, but not posterior.
Yes, the Deuk laser disc repair that you're watching. I can't speak about other endoscopic surgery because, frankly, that other endoscopic surgery is not as good as what we do. We perform the most advanced and the best endoscopic surgery. With our surgical techniques, we can get to a posterior disc herniation. More importantly, we can eliminate any symptom from a lumbar disc herniation. We've done now 1,900 of these surgeries endoscopically over the last almost 18 years. We're just a few months shy of 18 years. And in the 1,900 surgeries, we've never had a patient where we did surgery on the disc and the symptoms from the disc remained. Never, not one. So our procedure is 100% effective at fixing discogenic symptoms, lumbar, thoracic, cervical. Of course, to know for sure if I can reach it and fix it, I'd like to look at an MRI and do a Zoom call with the patient before I recommend surgery. That's why we have a free MRI review. It's free to anybody that wants to use it. We don't charge. We don't send you advertisement. We don't sign you up. We don't sell your information. We don't. I don't know about Google. Maybe they do. But our company does not. And point is, you can get a free Zoom 10-minute interview with me. I'll tell you exactly what's causing your symptoms and how to fix it. Now, the only caveat to that is this. If you have pain coming from a source that's not there when I do your Zoom interview for 10 minutes, then of course I have no idea you have that source. So during my Zoom interview, I do a quick exam. I get the patient to help me, and I can usually figure out where the pain is coming from. However, if you're not having pain from that area on the Zoom call, I can't figure it out. It's impossible. So you may show up and you have disc pain, but you also have piriformis pain, and then we don't know about the piriformis because you didn't have it when we did the Zoom interview. So if you don't have it when you do the Zoom interview, there's no way for me to tell you have it. There's no MRI, X-ray, nothing that tells you you have piriformis syndrome, unless we do a physical exam and you point to the pain. So there is a limitation to any evaluation of any patient, whether it's by Zoom or in person, that if they don't have pain from a specific source, when I see them, I can't diagnose the pain source because they didn't have it. So that's simple. It's logical.
That is it. The question.
Wonderful. 2 surgeries down, 1 more to go. Our next patient comes to us from New Hampshire. And this poor man has been suffering with back pain for like 20 years. He has 3 herniated discs. We're going to go on one side for one of them and on the other side for the other 2 because he's got back and leg symptoms. Lovely man, lovely wife, very nice people, and I look forward to helping him out. All right, have a wonderful day. Thanks for joining us. We have 1 more surgery at Deuk Spine